Our first inductee is Dr. Doris Browne. Over the many years of Dr. Brown's distinguished career, her work has included a wide range of things, including developing an education manual on sickle cell anemia for the Department of Health, Education, and Welfare, serving as, and for those who are younger than that department existed, that was the earlier incarnation of Health and Human Services, serving as the Department of Defense representative to the National Action Plan on breast cancer. You can see she's worked on a series of critical areas, and 9 years managing cancer prevention programs for the National Cancer Institute. Dr. Brown's current role is that of President and CEO of Brown and Associates in Washington, D.C., which specializes in improving quality health outcomes through increasing awareness and inspiring behavior change, central to so much of what we do in public health. She completed an internship, residency, and fellowship at the Walter Reed Army Medical Center and served for 27 years in the Army, retired as a colonel in the year 2000. She, of course, got her MPH from here, from our Community Health Sciences Department. She spent decades working towards eliminating health disparities, this central theme of tonight, and had this particular emphasis on prevention, health education, and wellness, which she was so effective at. So, Dr. Browne, we thank you for your service, your dedication to prevention and health, your commitment to addressing health disparities in our country. Please come up, and I want to congratulate you.
Thank you to Dean.
We're not supposed to read it, you are.
Thank you. Thank you. To Dean Hyman, faculty, staff, students, alumni, family, and friends, I am indeed honored for this, and it gives me great pleasure to return to UCLA after so many, many years. And to think that the work that I have been doing in all of these years can serve as a role model for the young people that are considering careers in public health, and especially for the minority students who wish to give back to their communities through public health. I am indeed honored. To paraphrase Woodrow Wilson from an address that he made in 1913, we are not here to merely make a living. We are here in order to enable the world to live more amply, with greater vision, with a finer spirit of hope and achievement. We are here to enrich the world, and we impoverish ourselves if we forget that errand. I believe that statement still holds true today, and I have accepted the challenge to try to live it out. I have been very fortunate in my career to serve the public's interests and to gain a global perspective on public health and medicine by interacting with people from various walks of life, not only in my local community, but throughout the world. However, there is still much work to be done. We need to enforce the immunization rates for preventable diseases, to increase the availability of affordable health care for all American citizens, to increase research funding in all scientific areas, to really strive more diligently to put prevention into practice, and to bridge the communication gap between consumers and providers, and improve our collaboration between academia, government, and private industry in order to better address the healthcare problems that we are faced with today and into the future. I would like to just conclude by a quotable quote from William Ward. "The adventure of life is to learn. The purpose of life is to grow. The nature of life is to change. The challenge of life is to overcome. The essence of life is to care. The opportunity of life is to serve. I believe that the essence of public health is about serving and making the world a better place." Thank you so much.
Our next inductee is Dr. Mario Ricardo Calderon. Dr. Calderon earned his medical degree from Guatemala's University of San Carlos in 1981 and his Master of Public Health degree in Health Policy and Management here at our school in 1984, a year, by the way, when I was in Guatemala. In the last 25 years, Dr. Calderon's public health work has spanned more than 20 countries. Dr. Calderon currently works for Novartis Pharmaceuticals in the role of medical access and health economics manager for Central America, Panama, and the Caribbean. Over the years, his work has spanned several sectors, and I think that speaks to the many areas where public health can have impact in government, in civil society, and in the private sector. His roles have included Chief of the National Epidemiology Surveillance Unit for Guatemala's Ministry of Public Health and Social Welfare, Area Health Officer in the Los Angeles County Department of Public Health, CEO and National Director of World Vision El Salvador, a Christian humanitarian organization dedicated to working with children and their families and communities to reduce poverty and injustice. He has served as a multidisciplinary team leader and policy advisor for USAID's HIV/AIDS program and their implementation in Central America, and done extraordinary leadership across multiple sectors. So please join me in welcoming him to our Hall of Fame.
Muy buenas tardes a todos. Good afternoon. It is indeed a real privilege, a blessing, and a pleasure to be here this afternoon. I flew up with family from Guatemala, where I have returned after 28 years being abroad. And fortunately or unfortunately, a pharmaceutical company brought me back. So it is my desire and my dream that over the next months or couple of years, I will go back to public health services. Think of me back in 1982 when I wanted to fulfill my passion to become an obstetrician and gynecologist. And people thought I was going to be a leading OBGYN in Guatemala. But then I had a change of plans, a change of minds and hearts, and went into public health because I wanted to address the health, the economic, the social, the educational issues of my country. And this is where I am today, 28 years later, and I have returned to Guatemala, and I still want to change and restructure and revitalize our system. But then I said to myself, I have to get the best education possible if I want to be a public health practitioner. And I want to tell you and share with you how did it happen that I came to UCLA. Back in Guatemala, this developing country expert wrote to 5 universities, the Ivy League ones of Johns Hopkins, Harvard, Yale, I believe also Tulane, and UCLA. And 4 responses were what I consider passive attention responses, which were thank you so much. Here's the information packet. Good luck. But there was a 2-page response, a 2-page warm letter from a doctor that I didn't know, who has become my reference ever since, Dr. Paul Torrance, who I honor today, and he will be with us this at dinner. He wrote me, and the messages were, don't make a decision. Come to see us and talk to us first. We have a program specially tailored for you, for MDs. It is an 11th-month program. We can tailor this to your needs, your country needs, not what the professors here think you need. So I came, and I was very fortunate to then come to the School of Public Health, and I didn't come along. I brought my brother. He also got an MPH, so we are 2 Calderons, and we graduated and have worked since then in international public health services, including Los Angeles County. Now, I want to tell you that one of my first classes was preventive medicine and public health. Remember that green book from Professor Last? And there I met Dr. Breslow. So I had the honor of being his student, and with him was Dr. Fielding. So they were my first 2 professors, and I'm very thankful to them. I strongly believe that an award like this is not won by one individual. So it's a collective award. And I'm so thankful to all of the schools that have trained me, to the employers who have employed me, to my professors, to my mentors, to my pastors, to my peers, my colleagues, my friends, my family, who all have contributed to enrich my family. And since we have students here, I want to tell you the following. I have learned 3 things in my life, besides many other things, of course. But I have learned 3 things that can make an impact in any health system, any place in the world, in any country, whether it is public, private, or nonprofit. And I have mastered them, I think. I have cherished them, and they have allowed me to fulfill many of my dreams and also to help a lot of people. One is, we can always modernize, update the financial, the programmatic, the managerial, and the technical capacities of any system. And in my experience, in more than 20 countries and in many institutions, there's a desperate need to enhance these areas of our public health services. Second, we can always strengthen what is going well, but we can always expand and diversify programs, services, and strategies. And third, we can do things to achieve local, to achieve regional, and to achieve national and international impact. So I want to leave you with those 3 pieces of information about what it is to practice public health. And if you do that, I think that you will be able to enhance population, health, and development outcomes here in Los Angeles, or in the nation, or in any place in the world. I'm very pleased, as I have said, and honored to be here. Thank you very much for selecting me as one of your inductees. I am grateful to the school, to the professors, to the people that I've mentioned, and I am not retiring, okay? Although I'm 60, I just have returned to Guatemala a year ago, and I was talking to Dr. Fielding and telling him my plans. I do intend to seek the opportunity to enhance the health status and well-being of the population in Guatemala, primarily by restructuring, revitalizing a health system that is in desperate need to be restructured. So thank you so much. Muchísimas gracias.
Our final inductee this evening is Dr. Fred Wasserman. Dr. Wasserman holds 2 degrees from our school, an MPH in the department that is now Health Policy and Management, and a DrPH, which he earned in 1976. Dr. Wasserman put his degrees to work as a founder and CEO of an early HMO in Los Angeles called MaxiCare. MaxiCare eventually grew to include 2 million people across 26 states. And his wife, Pam Wasserman, who joins us tonight, is also an alum and founder of MaxiCare with extraordinary work there. I just want to pause a sec for the students and say, I talked before about civil society, the private sector, government, but certainly the work that our alums have done as entrepreneurs and in founding organizations, whether it's a social entrepreneur or private sector entrepreneur, has been extraordinary. And we're excited about what our inductee has done and excited to see all the things you will do. In addition to Dr. Wasserman's role as CEO, he has worked in the strategy and around health service systems as a consultant to senior management at both large companies and startups. And he's remained active at the School of Public Health here as an adjunct associate professor and served on our Dean's Advisory Board, for which we are grateful, for more than 20 years. Dr. Wasserman's influential work has touched many lives, and he continues to provide expert advice in his current role as a member of the Board of Directors at the La Jolla Institute for Allergy and Immunology. Dr. Wasserman, for your many accomplishments, we're thrilled to be able to honor you tonight as an inductee in our Hall of Fame.
Needless to say, I'm overwhelmed. I want to thank the committee that made this selection. There are certainly all the other two people have tremendous accomplishments. And I can only tell you that having grown up in Los Angeles, I was born here, I went to Hollywood High School, I went to UCLA as an undergraduate, as a graduate, and a graduate, and I feel like I've always gone to school here. And I look around this room, and I was in the class of 71, 72, and I see Ray Goodman, who was a classmate of mine, and of course my wife, who wasn't my wife then, who I was fortunate to meet at the school, and who certainly participated in my career, and I participated in her career, and really she should be up here with me as well. You know what? It's really difficult to talk about this when you have such great people that also received this award. But my focus is a little different. We're going to spend 20% of our healthcare, of our GNP on healthcare. It's coming very close. Can you imagine that? And probably the largest employer, or second largest, depending on whose statistics you look at, the United States, is the healthcare industry. Now this is really sort of extraordinary. Yet, we have an industry that still has not really performed. The quality issues still persist. Accountable care organizations, which Pam and I were fortunate in creating in 1982, along with Northwestern University and its medical school, is now accepted as a way to provide care, and perhaps will work given the opportunity that of the futures. But on the other hand, you still look at the medically underserved population, you look at the health disparities. I was certainly glad to see the issue on culture being addressed, because we saw it while we were providing care within our organization. We were innovators. We were attacked as being communists because we wanted to change the system. How can you do that? Our doctors were called socialists or communists as they walked through the halls of the hospital. I mean, can you imagine this? I mean, we live in America. We were trying to do things to change the system, to improve the care, to provide better access, to find ways to measure the quality care, both technically and also in terms of consumer satisfaction. So we did some innovations. We put health education in in terms of nutritional counseling for pregnant women, and we were able to reduce the incidence of low birth weight babies. A study was published in the the American Journal of Public Health. I mean, there's an example. We were able to take and do early discharge on pregnant women. This is in the 1970s. We could do 1 to 2 day discharge. We would use a nurse practitioner to visit the home. Some of the nurse practitioners were cross-trained in pediatrics, so they could also check the baby. I mean, look how long ago this occurred, and look at how long it's been for us to really begin to accept this way of providing care. But you have to even go back further. And there's a publication that was written in the 1920s called Medical Care for the American People. I think it had 20 volumes, and it had some of the brightest and most greatest people of the time who knew a lot about healthcare. There's physicians, there's sociologists, and this is a very important publication. In there, a recommendation was made that healthcare ought to be provided in an organized setting like group practices. It ought to be provided on a prepaid basis, and ought to be available to everybody, like universal care. Now, it only took us 80 years to get there. So, I mean, you know, we think these things are happening, and I want to sort of tell you that you are very fortunate, the students in this room, to attend this school. Pam and I both loved our time here. We love this school, and we feel very, very strongly about everything that's going on here in terms of the direction. And you know what? As I talked to a group of students at lunch today, there were 10 of them, they all asked great questions. They were all committed. They all had career focus. You know, I think we should be very proud of the students that are coming through this program and the professors who are teaching these students, because that's what we're looking for. And you know, not all the issues are easily solved, and most of them aren't easily solved. And the politics of healthcare are really brutal, as you all know. And the cultural diversity issue is very, very important. But the politics are the worst thing we have to deal with. Thank you.